Fenesin Dm Ir is a combination medication used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin, one of the components, thins and loosens mucus in the airways, clearing congestion and making breathing easier. The other component, dextromethorphan, acts on a part of the brain to reduce the urge to cough. It's important to read the package instructions carefully before starting to use this product, especially if you are self-treating. This medication is not recommended for children younger than 6 years old, and some forms are not recommended for children younger than 12 years old. It's important to follow the dosage directions to decrease the risk for serious side effects. Do not use this product to make a child sleepy, and avoid giving other cough and cold medications that might contain the same ingredients without consulting a doctor or pharmacist. When taking Fenesin Dm Ir, it's important to follow the directions from your doctor or the product package. Drink plenty of fluids to help break up mucus and clear congestion. The dosage will depend on your age, medical condition, and how you respond to the treatment. Be sure to measure the liquid form carefully and do not use a household spoon. If you're taking the powdered form, empty the entire contents onto your tongue and swallow. If you're using the capsule form, swallow it whole. It's important not to abuse this medication by taking more than directed, as it can result in serious harm. If your cough returns or if you experience certain symptoms, such as a persistent headache, fever, or rash, contact your doctor. If you believe you may have a serious medical problem, seek medical help immediately. Some common side effects of Fenesin Dm Ir include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned here, it's best to consult your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Fenesin Dm Ir, it's important to let your doctor know if you have any allergies to guaifenesin or dextromethorphan or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. Before using this medication, make sure to inform your doctor of your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. Fenesin Dm Ir may cause dizziness or drowsiness, and combining it with alcohol or marijuana can enhance these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also advised, and it's recommended to talk to your doctor if you are using marijuana. If you are diabetic, have liver disease, or have any other condition that requires you to limit or avoid sugar and alcohol, caution is advised as the liquid forms of this product may contain these substances. It's best to consult your doctor or pharmacist about using this product safely. The liquid forms and powder packets of Fenesin Dm Ir may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Fenesin Dm Ir should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It is unknown if guaifenesin or dextromethorphan passes into breast milk, so it's best to consult your doctor before breastfeeding. When taking Fenesin Dm Ir, it's important to be aware of potential drug interactions. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, and phenelzine, while using this medication, as it may cause a serious and possibly fatal drug interaction. It's also important to be cautious with other medications that may interact with Fenesin Dm Ir, such as rolapitant. Additionally, be mindful of the labels of your medications to ensure you are not taking more than one product containing guaifenesin or dextromethorphan, as they are available in both prescription and non-prescription products. Lastly, guaifenesin may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and your doctors that you are using this medication. As always, consult your doctor for the best time to take this medication and the appropriate daily dosage for your specific needs. If someone has taken too much Fenesin Dm Ir and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. It's important to take the correct dosage of Fenesin Dm Ir and to seek medical help if you suspect an overdose. Always follow the recommended dosage instructions and consult with a healthcare professional if you have any concerns. Remember to take Fenesin Dm Ir at the same time every day for the best results. If your doctor has prescribed Fenesin Dm Ir for you, it's important that you do not share this medication with others. It's also crucial to keep all of your medical and lab appointments to ensure that this medication is working effectively for you. If you forget to take a dose of Fenesin Dm Ir, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Fenesin Dm Ir, it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and avoid freezing the liquid form. Different brands of this medication may have different storage requirements, so it's essential to check the product package for specific instructions or ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When you no longer need Fenesin Dm Ir or when it has expired, it's crucial to dispose of it properly. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the correct disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.